It's Friday, October 3rd, 2025. Welcome to Make It Make Sense. I'm Granthermes. Today on the show, we're going to take a look at what's happening with our health government agencies. It's been a little bit since I've really talked about all the stuff that is happening in the MAHA or Make America Healthy Again movement, and it's something that really exploded last week when the government said that Tylenol, acetaminophen, was linked to autism despite ample evidence that it's just not. And so my guest today is a three-time guest. We've got a very few number of those, and it's always fantastic to have a conversation with Dr. Scott Greer, a professor of public health policy and politics at the University of Michigan. We talk all about what this thing with Tylenol and autism actually means, how we shouldn't get sucked down the conspiracy rabbit hole when we hear these things from our now federal health, quote-unquote, I suppose, experts, how the wellness industry and the grifting that comes out of that is now blending with what we used to think was good medicine and science, and where we go from here. Now that these things are federal policy, what happens next? Who can we trust? Who should we trust when it comes to, say, should I get my kid vaccinated or not? Should I get myself vaccinated or not? Or should I reach for that bottle of Tylenol or not? It's a really good conversation, and I actually left it, despite the news being what it is right now, a little bit more heartened about who we can and should trust and what actually might happen next here, because Scott thinks this thing is a hostile takeover and that it might actually be really inconvenient for the White House and for the entire thing they're trying to do to have the MAHA movement attached to them. And he's not sure it's long for this world. But before we get to that, make sure you rate and review the show on whatever podcast app you listen to it on. Make sure you're subscribed or following it. Sign up for the Make It Make Sense Substack, where I've got a brand new article up this week all about how the United States isn't a full democracy anymore. We're something else. That's up for free right now. You just got to subscribe and become a member for free. And as always, share the show on social media. It's MIMS Newspod. That's MIMS Newspod, all one word on every platform. I am at Granthermes on Twitter and Bluesky, and at Granthermes TV on everything else. All right, let's get to my conversation with Dr. Scott Greer. I try hard on Make It Make Sense to give you a complete picture of the biggest stories, but I'm only one guy, and staying up to date with events around the world can be difficult for anyone when it's impossible to consult a single source for the full story. And with our social media algorithms sending us the versions of the news that only reinforce our own biases, it can be hard to know if you're actually informed, even for me. And that's why I've been using Ground News. Ground News is an app and a website that combines news from around the world all in one place, so you can compare coverage from every news source, and you can see if they have a political bias, how reliable their reporting is, and who owns them. My favorite feature is the blind spot feed. It highlights news disproportionately covered by one side or the other, so I can make sure I know how the news is being covered. It's like Make It Make Sense for Make It Make Sense. Right now, if you subscribe through my link in the show notes, you'll get 40% off the Vantage subscription. It's the one I use to get unlimited access to every feature, and it is just $60 for the entire year or $5 a month when you use that link. Your subscription helps Make It Make Sense, too. We get a cut of this subscription, but you're also helping Ground News make the news more transparent. Again, use the code in the show notes to get 40% off your Vantage subscription to Ground News. All right. Let's get back to the show. Well, Scott, thank you so much, as always, for being here. One of the only three-peats I've got on the show. And I really wish eventually we'll be able to talk about something good in the public health space, but that's not exactly what we're doing here today. But nonetheless, thank you for being here.
Thank you for having me. I'm really honored to be a three-peat.
Yeah, there'll be a jacket in the mail or something. It's like SNL. So let's start here with the big news from last week. And it does snowball into a bigger idea, but this announcement about Tylenol and autism, and there just isn't a link between these two things, right?
There isn't a link. Painkillers are associated with ill health, but I think I got a reason for that, right? I feel fine today and I didn't take any painkillers. Guess why? More seriously, there's a lot of research on all of these aspects. There's a lot of research on any drug as widely consumed as Tylenol, because if it were killing people or making them sick, the numbers are so enormous that we would have found it and tracked it down. And equally, we're picking on Tylenol because, as far as I can tell, President Trump doesn't know how to pronounce acetaminophen.
You certainly didn't in the press conference, so yeah.
Yeah,
Yeah.
the press conference was an astonishing watch. I strongly recommend it. A bit weird to be getting health advice from people with that affect, really.
Yeah.
But the idea was that, according to President Trump, don't take Tylenol, said that, I believe, 8 times, 10 times. And it's because, especially if you're pregnant, and that's unfortunate because Tylenol acetaminophen was one of the few painkillers or fever reducers that was available for pregnant people, and fever in pregnancy can actually be a real health threat, right? So this is both going to be a big literal headache for pregnant people. It's also going to actually potentially lead to health downsides if they don't take Tylenol and let a fever run unchecked, or if they take things that are much more demonstrably dangerous to people in pregnancy, such as ibuprofen, which is really not a great idea if you're pregnant. So, but also, I think he's calling it Tylenol. It's a bit weird to go after that. It's a bit like attacking Kleenex when what you really want to go after is facial tissue. So, in terms of public health communications, we're picking on a single company's branded product. Good day for them.
Oh yeah, they scrambled. They were unhappy. Yeah.
So,
Yeah.
if you went to Walmart and bought acetaminophen, would you know that President Trump said it's unsafe?
Right. If you didn't know the difference, if you didn't know they were the same thing, like what does that mean here? It was an interesting display, I think, and we talked about this kind of before we started rolling here, of like these two grifts meeting each other, in that, Trump wants to be the strong man of this thing, but then they brought in these health grifters in RFK Jr., in Makari, in Oz, and now you're getting this thing where like they're singling out Tylenol for another drug, which I'm fairly certain Dr. Oz has a stake in, and I can't remember the name of that drug actually off the top of my head, but yes, right?
Leucovorin. So, a man who famously, for example, invented green tea extract more or less on the fly as a thing to boost, is now boosting leucovorin, but at least this time there's a fairly clear conflict of interest.
Right.
These guys are really interesting because people like Oz and Makari and Bhattacharya, they were having really, really good careers at the top of the establishment. So there's kind of an interesting question about what is it about COVID or political ambition that led them to reject their professional communities and their professional training and move into this very weird space that they've gone into.
Mm-hmm. There's also an idea here that we can get really caught up in, looking at the nitty gritty of, well, they say there's an association between Tylenol and autism, but it's the scientific definition of association, which isn't correlation, which isn't causation. Can you walk me through that idea first before we get into the idea of not following these things down the rabbit hole?
Well, it's in terms of the language of epidemiology and biostatistics, like there's a reason that people tend not to do this with anything less than a master's degree. It's really quite subtle. But to go back to the example I used, right? There's an association, meaning that people who are taking painkillers tend to be people who are ill. And I can say there's an association between painkillers and illness. Therefore, painkillers might cause illness. And if have mastered conspiracist language, then indeed that Tylenol is making you ill. Back out. Let's rejoin reality for a second. You wake up with a bad head. You take an ibuprofen or a Tylenol or an acetaminophen. Like, that's the causality, right? Two things happening at the same time doesn't actually provide an explanation. And that's kind of statistics 101 in any university class. And so if you're misusing it while having the level of education and administrative and scientific support of HHS, you're doing that quite deliberately. Honestly, I'd say the more interesting question is why they went after Tylenol, because we all thought they were going to go after the MMR vaccine. And while President Trump did give a long, strange discussion of a vat of liquid going into babies, which is not realistic, I really wonder what kind of last-minute bait and switch meant that we decided to advocate for leucovorin and against Tylenol and not say the word acetaminophen instead of what everyone predicted, which was another assault on vaccines.
Yeah, I don't know that either. I do think it's interesting that there is. I wrote about this a couple weeks ago too, almost 2-3 weeks ago on the Substack, about how what we're seeing right now is this collision for Donald Trump specifically. He's been vaccine we'll call it hesitant for a long time, well before he was on The Apprentice, even before he ran for president the first time. He's been in those waters. They slow walked his own kids' vaccination for Barron, and then hung around with like Andrew Wakefield, the guy who started the vaccine causes autism conspiracy theory, the debunked terrible study. And so it's this weird thing where we're now getting these two worlds together, and he just seems to really want to buy into this.
I think there's okay. I'm not that sure that Donald Trump cares, and I'm not that sure that he's honestly telling us what he's doing with his own or his kids' health. If you back out politically, the strategic problem is that a lot of this MAHA stuff is what we call a wedge issue. And a wedge issue is a real simple concept. It unites your base and it divides the other guys, right? So, for example, Gaza is a wedge issue against Democrats. It unites Republicans and it divides Democrats. I think a lot of the health thing is actually a wedge issue for Democrats. And I think that part of what the White House is trying to do is manage the problem. Because Democrats are increasingly, Democrats have stayed as pro-science, pro-vaccine, pro-public health as they were 20 years ago. It's Republicans who have a significant group of voters and party elites who have turned against all of those. And so an issue where the Democrats all agree with each other and half or two-thirds of Republicans agree with the Democrats isn't an issue you want to be foregrounding, right? Like, that's just bad agenda management. You want to go back to talking, as the White House, you want to go back to talking about something where all the Democrats are divided and the Republicans are agreed. So this is kind of strange political messaging. And I think you overlay that with, for example, leaks coming out of the White House that Trump is unhappy because he didn't get enough credit for Operation Warp Speed. Because I think if most honest observers had to look at the first Trump presidency and say what was an unqualified success by any reasonable standard, they'd say Operation Warp Speed. We got great vaccines at warp speed.
Yeah, absolutely. I mean, I have said that on this show before. Like, that was a triumph of the first administration for him. Absolutely. He also then spent the last several years calling those vaccines dangerous and working against the thing that he built. So it was always weird to me that he was like, I never got enough credit for that. And I was like, well, you sort of dismantled that on your own, man. Like, I don't know what to say to that. Yeah.
Well, I'm not sure that fidelity to any one policy opinion is like Donald Trump's calling card here.
Right.
And he did say at Madison Square Garden, I believe, that he was going to let RFK Jr. quote, go wild with health, and wild RFK Jr. is gone.
Yeah.
And going back to the kind of rabbit hole question, right? There's entire languages here, right? There's a language of biostatistics and when you can say which kind of inference there is. There's languages of pharmacology and epidemiology, and they're technical, and little nuances mean a lot, and that's why the articles are hard to read. And then there's also process, where it's kind of sad watching poor political reporters suddenly try to figure out what the United States Preventative Services Task Force is and why they should care, and then how it gets laundered through insurance companies and recommendations by professional associations and state regulators. And there's this giant process nightmare if you try to sit down and figure this stuff out.
Mm-hmm.
And I think the key takeaway to avoid just getting lost and depressed is to think of it, it's a system which from top to bottom was built on two assumptions. One was that the civil servants would do their job of implementing the law, and that they'd be good at it, and that they'd been selected to be good at it. And the other was that the experts would do their job of providing the best advice based on a whole lot of research and understanding of studies in the literature. And what RFK Jr. has done, and to his credit, he's done this very well, right? He understands the bureaucracy better than some of us anticipated, is he's turned it inside out. He's taken away the assumption that this process is run by people who care about getting the answer right. And he's replaced the experts with people who are basically COVID-19 anti-vax celebrities of one sort or another, most of whom have impressive academic credentials in the wrong field, right? Industrial engineering at the business school for MIT is a very impressive intellectual background and really has nothing to do with how you should, handle school health.
Yeah. So I will say this is not really connected to the conversation we're having, but something is happening with our engineers and computer scientists in the country. They think that once they've got those degrees, they are qualified to do anything else that deals with numbers and something technical sounding. It's this, I know that there's a phenomenon named for somebody who discovered this thing, but it's really in spades when it comes to this health grift thing. when it comes to the idea of, we've turned, I shouldn't say we, that the administration has turned the American health institutions that existed on their heads. How much more dangerous are things then? I mean, you look at the restructuring of just the people who approve vaccines and when we should be taking vaccines. Like that seemed to be, if just a few years ago, very clear on how this should work. And now it feels like quite a few people, mostly children, will be in danger.
I couldn't get my daughter a vaccine, sort of because the pharmacy in question didn't know what the guidance was. And this was when the insurance companies and the professional associations hadn't started to make it clear that they're still pro-vaccine, because the cost of a hospitalized kid is so overwhelming that they'd love to pay for vaccines instead, and they can look fairly clear-eyed at the safety data. This system was in many ways trusted, right? So there's this broad phenomenon that trust in everything is declining.
Yeah.
And then there's all these little conversations among people in different fields about how do we restore trust in vaccines, or how do we restore trust in the media, or how do we restore trust in the army, or whatever. And the problem is the definition of trust. Because if you ask people whether, for example, a common poll question is, do you expect other people to do the right thing? And answers on that question have been getting more and more negative for decades. Do you expect the government to do the right thing? Answers on that question have been getting more and more negative for decades, mediated by the fact that Democrats trust Democrats and Republicans trust Republicans. But then there's a lot of empirical behavior where you act like you trust somebody, right? You take the vaccines that your pediatrician recommends, and your pediatrician recommends them because professional associations and the CDC and the scientific research teams have come up with an answer that you trust. So there's a lot of demonstrated trust in America. If you buy it in a store, you assume it's safe. If it's recommended to you by your doctor, you assume it's safe. And now we're really attacking that level. We're really going after if CDC says you should space out vaccines, do you listen to CDC, or do you say, hey, CDC's in the hands of MAHA, maybe I should go find someone else to educate me? So now people who want to believe in science and trust the process are being pushed away, encouraged to do their own research.
What are the knock-on effects of that? I mean, from a standpoint of, will that cause, do you think, people to not get vaccinated as often? Will they see their doctors less frequently? Is there on a global scale, a thing that we've talked about before? CDC, NIH used to be the global gold standard for this kind of information, and now it's not. And so what happens to American health standing? But let's start with the small before we get big.
This is going to be my happy ending. But I guess we'll try it now. Which is one of the nice things. It's been one of the broad mysteries about American democracy, is why more of our civil society hasn't stood up. But what you're seeing, and I alluded to it, is the health insurers and the professional associations, many of which were very mealy-mouthed about RFK initially, and sort of said, we think he's wrong about everything, but we also agree that fruit is good.
Right.
We've got a lot of this kind of, he says one thing and they pick on that. And they're coming around and saying, we as pediatricians, you have got to vaccinate these children. Like, whooping cough sounds funny, but a lot of the time they don't even bother to cough, they just die. Measles, there's a bunch of jokes from the 1950s, but measles is terrifying. It's incredibly contagious, and among its other features is it can cause effects that only appear 10 years later. Or it could mess up your immune system, so you're more vulnerable to things you've already had after you've had measles. And so you're seeing them stepping up. Now, the problem is the law as to what insurers need to cover and so forth, and what states and school districts need to do, is often geared to this federal advisory system that is in the hands of, as the chair of ACIP, the Advisory Committee on Immunizations, said, we're rookies. That was when they, over 2 days, failed to pass the motion they thought they were passing, right? They didn't even have their own rules right. So it's great from a well-insured middle-class person's point of view to say the Academy of Pediatrics and the Association of Health Insurance Plans agree that this COVID vaccine is appropriate for me. That's cool if you have good insurance. What if you need it from schools in a district in a red state? What if you need it from a pharmacist who isn't plugged that well, community pharmacist who might not be that well plugged into networks, or a corporate pharmacy that is run by risk-averse lawyers? So It's good that you're having the professional associations stand up, but that's not the same thing as the actual federal recommendation, which is where the rubber hits the road, and where at the moment we're in confusion and we're heading towards a much less pro vaccine and a much more pro grift regulatory framework.
Right. Because what fills that vacuum then when we're talking about this? I mean, is it just the grift fills that space because they tend to, because people are scared and they look for quick fixes? Is that how this stuff works?
I think this might be why it's a political liability, right? Is because on one hand, this is a fantastic time to be a grifter, right? Including you can get direct federal funding, whatever nonsense what you want, right? We're going to be one of the problems that we might face in 2029 or 2030 is a whole bunch of people with a whole lot of federal government funding and universities with a whole lot of funding where you can't, like Texas, where you can't tell if they got it because of political payola or because they're actually good at what they do. What's filling the space we don't know yet. This is moving really quickly. And like I said, your average middle class person with decent insurance is going to get approximately what they would have got last year, which is how the local pediatrician and a chain pharmacy interpret what the Academy of Pediatrics, other professional associations, and the Association of Health Insurance Plans agree is good practice. They're just going to quietly ignore CDC for a year. So you're going to see it start with the marginal populations, right? So the middle class, well insured family will feel it when we have a measles outbreak and their baby who's too young to be vaccinated catches it.
Right. Right. I mean, cases of measles have exploded already around the country. Whooping cough has, it's in the thousands at this point, the number of cases, which we haven't seen in quite some time. And that's children and babies who cannot breathe. Like it's insane to me that this is happening in 2025.
Well, about a quarter of Republicans say that vaccines have killed more people. COVID-19 vaccines have killed more people than COVID-19, right? So there's a lot of scope to live in a world of disinformation if you choose to.
Yeah. How do you, as somebody who works in the public policy health space, how do you push back against that? Because it feels so potent.
Podcasts?
Yeah. Start there. Yeah. Always good. Yeah.
No, I mean, seriously. So there's the good news. There's two forms of good news here to do with public opinion, right? So one is that a lot of people are going out and getting vaccines, even if they are occasionally mimicking anti-vaccination talking points. That you make your own decisions as do your own research and make your own decisions as an anti-vax talking point. But a lot of people can say that and then say, and I personally decided to get a proper slate of vaccinations because I don't want to get sick. So there's a lot of behavior that is not matched to telling pollsters what they think RFK Jr. would like to hear, so to speak. And the other is that there's just a lot of practical trust. I mean, people really, really, really trust their doctors. Do not underestimate the ability of your doctor as more or less uniquely among everyone in society to influence your health decision making. And don't underestimate the ability of medical associations, if they're really speaking for their practitioners, and with the pediatricians, they clearly are, to influence how people understand political issues.
What happens after we break this thing? Can we put Humpty Dumpty back together again here?
Asterisks that we might not want to put Humpty Dumpty back together exactly the same way.
Yeah.
Right. You don't want to be I don't think there's a single person in this space who says that what they really, really want, what they really dream of for Christmas is to wake up in the morning and find NIH or CDC or FDA as of January 19th, 2025 under the tree, right?
Right.
And there's an opportunity to rethink this, right? So we have these agencies, the Agency for Healthcare Research and Quality. It's gone, right? For all practical purposes, there isn't one. So let's invent a new way to think about how the United States improves healthcare quality and it manages to avoid dangerous things, right? The FDA funding model created huge conflicts of interest. Well, now that you've wrecked half of FDA, what are the opportunities to rethink the way we were doing that? You can kind of go through this list and say, it's not just putting it back, it's putting it back better. It's putting it back in a way that might earn trust that has been lost, and also that might bring back highly skilled people who, based on the ones I know, they're making twice as much and working half as hard in private industry now. How do you get them back? Or how do you attract new people with master's or doctoral degrees or medical degrees who have been watching this and thinking, wow, civil service jobs aren't as secure or as public spirited as I hoped.
There's one last thing I want to talk to you about, and that is, how are you feeling right now as somebody who works in a public health university about how the administration has been targeting universities and the intersection of what we're seeing at our federal health agencies and this campaign to dismantle what we understand to be higher ed education, or higher ed institutions? It seems to be a tricky spot to be in right now for someone like you.
It's not a lot of fun. I most of my training is in comparative politics,
Hmm.
so I've spent more time in Hungary than a lot of the people who are talking about the authoritarian playbook.
Yeah.
It's an attack on institutions that they've correctly identified as being involved with everything they don't like. They're autonomous institutions. They're institutions full of people who are characterologically bad at saying what their employer wants them to say.
Hmm.
They're institutions where a lot of people are pro-democratic party. They're also diverse institutions, right? I don't turn students into Democrats. What happens is arriving on campus and rooming with somebody from a totally different walk of life
Yeah.
makes people change how they think about the world, and sometimes that leads to a political change, right? It's the mixing of undergraduates that drives them crazy, combined with the experts who are paid to say things that are inconvenient for the wellness industry.
Right.
So I think I'd frame it as we're the federal government has seen a hostile takeover by people who have a shared interest for a variety of reasons in simultaneously undermining government, science, public health, and higher education. And they come from a number of different places, whether they want more religious homeschooling or whether they want more wellness grifting. And there's a lot of points of connection.
Hmm.
And they're using all the discretion that the Supreme Court will give the federal government, which is way more discretion than reading the statute would suggest, to come after these big, proud, influential institutions. And what I think most political scientists who think about this have been screaming is, don't underestimate the influence and popularity and power of things like universities relative to a very unpopular president with a
Hmm.
lot of very polarizing policies in this area, right? There's a lot of misleading surveys about, for example, how valuable is a university education. And when you look at what people actually say when they mean by university education, they tend to mean 4 years at Harvard, right?
Right. Right.
When you make sure that they understand that this also means community college or a 4-year regional public or liberal arts college, Americans like education and they understand that it's good for you,
Yeah.
right? We're having this surreal conversation about Penn and Harvard. Intermittently, UCLA or unfortunately Michigan gets onto the screen.
Hmm.
And that's not what higher education looks like in the United States. And that's not what people actually see when they go take classes and get a better salary and a degree.
So kind of in the same way that where people trust their doctors when it becomes a little more local about their education or their alma mater, if we're talking about it in that way, they tend to be less trustful of these attacks and less positive about them.
Yeah. And also, one of the really striking things is if you look at agreement, and there's a long series that Pew has been doing in surveys with
Hmm.
the basic thesis that higher education is good for society and higher education is good for you. It was always roughly parallel. Republicans were often a little bit more likely to like higher education because they tended to be a little bit better off, and that correlates with having degrees.
Hmm.
And then it just drops like a stone in 2016. You can see the decision that higher education is the enemy, and you suddenly lose 15, 20 points instantly off of Republican support for higher education. And it hasn't changed much since then. But what's happened is that the increasing radicalism of the whole Republican Party in favor of this anti education message has percolated through its elites in the same way that openness to grifting and opposition to public health has become much more popular among Republican leaders.
Whew. Scott, before we go, there is a pretty big game tomorrow. I'm a Badger. So it
I'm
is.
sorry. You're from Wisconsin, right? I understand this.
No, I'm kidding. I'm kidding. Really, thank you so much for coming on today. I really appreciate it. I know it was kind of last minute, but it's always important to do a checkup of what's happening with the MAHA stuff. So thank you, really.
I really think this could backfire for them, and I think a lot of the people in the White House think this is a dead weight that's interfering with whatever they want to do, be it China or deportation or tax cuts. I think there's a lot of people within the upper reaches of the Republican Party who kind of wish RFK Jr. could be reined in.
I want to thank Scott again for coming on the show. As always, you can find links to all the great work that he's doing at the University of Michigan right now in the show notes to this episode. And that is it for this episode. Thank you so much for listening today. As always, rate and review the show on whatever app you listen to it on. Like, subscribe, leave a comment below if you're a watcher on YouTube. It really helps boost the show there. Sign up for the Substack and share the show on social media. It's Mims News Pod. That's MIMS News Pod, all one word on every platform. I am at Granthermes on Twitter and Bluesky, and at Granthermes TV on everything else. Thank you so much for listening today. I'm Granthermes, and I'll talk to you on Monday.